Good morning. Ayushman Bharat scheme launched by Government of India, in which import of goods is decreased, so as the production of goods inside the Bharat is increased, and low interest loans are provided to the entrepreneurs. These are the international foundations: CEDA, DANIDA, UNESCO, WHO, UNFTA, UNDP. UNDP is funding the SDG. UNESCO is for educational, scientific, cultural, and कहाँ पे इसका हेडक्वार्टर है? Where is headquarter located? Paris and Rome. In PM, overarching scheme for holistic nutrition portion, in which there are 3 programs: AMB, reduce anemia, reduce anemia cases each year by 3%. In PM portion, मिशन ऑफ एजुकेशन, मिनिस्ट्री ऑफ एजुकेशन के अंदर आता है, comes under Ministry of Education, along with school, children, preschool and school also, in which half of protein and 1/3 of calories provided per day. Half of protein because we all know poor pupils eat bhat or rice, so they get enough calories but not enough protein. So half of protein and 1/3 of calories is given. Nikshay is no or share. Nikshay means share rog stands for TB. Nikshay portion is name of full name. 50 rupees per month every TB patient. If for to any outbreak, we have to report it within 24 hours. And marriage is to be registered in under sub-centers, and birth and death of children, to be registered at 21 days at PSC. Now if outbreak is occurring like loose stool, so first we have to take the sample and test it for what causes the diarrhea. If cholera is the reason, then doxycycline 100 mg TDS for 3 days. If typhoid is the cause, then ciprofloxacin, and gastritis if the gastritis cause, then metrogyl is to be taken. This Plasmodium falciparum, it is of sickle shaped inside the RBC, for the active surveillance of malaria. Multi-purpose worker, male health worker male by active surveillance, make the go door to door and ask for any fever or weight loss, and if a patient suffers from fever or weight loss, then he took sample and make 2 slides. This is a type of active surveillance in which health multi-purpose worker search for any hidden cases inside the for hidden cases in society, and all the cases which are to be notified by the doctors, it comes under passive surveillance, and both comes under sentinel surveillance. In Aminima Book Bharat, there is 6 strategy of 6x6x6. In this 6 interventions, 6 beneficiaries, and 6 institutional mechanisms are infrastructures are taken into account. 6 interventions are prophylactic iron and folic acid tablet, deworming on every 10th of February and 10th of August, 5 days before 15 August, and 4 days before or Valentine Day. So we can learn this. A solid body, smart mind is the logo, and testing of anemia using digital methods, and point of care treatment, POCT. Fortified food rich in iron. No nutrition causes of anemia like hemoglobinopathies, malaria, fluorosis. This is the table of how much ICDS how much nutrition is to be given. Normal child 500, all females में 600, malnourished children 800 kilocalories. For protein, normal children 15, all females 20, and malnourished 25, higher than all females. Now next phase is NPCDS. National Program for Cancer, Diabetes, Cardiovascular and Stroke. It is a name change for the non-communicable disease control program, NCDs. Most common cancer in male of India is oral cancer, oral lip and oral cancer, because of tobacco use, canny or uh, most common cause in most common cancer in world is breast cancer. Most common cancer in females is also breast cancer. Most common cancer of males in of world is lung cancer. Why is that breast cancer is the most common cancer in world? Because breast cancer has higher prevalence, because of the reason as uh, there is a good cure, so that the duration of the illness increases, but incidence does not increase. So overall, prevalence is equal to incidence into duration. So if duration increases, prevalence also increases. INAP, Indian Newborn Action Plan, in which there is a logo of there is a some like jhula, and here a baby is sleeping. This is the logo of INAP, Indian Newborn Action Plan Program, in which at PSCs one infant bed at PSC, एक 1, 6 एंड 12, 1, 6, 12 से याद रखिए। PSC इन्फेंट बेड और PHC होते हैं, एंड देयर इज ए न्यूबॉर्न केयर कॉर्नर, केयर स्टेबलाइजेशन स्पेशल न्यूबॉर्न केयर यूनिट SNCU. One bed at PSC NBCC, it is inside the labor room. 6 bed at CSC and newborn stabilization center near the labor room, and infant bed at 12 infant bed at TH, which is स्पेशल न्यूबॉर्न केयर यूनिट. RBS के राष्ट्रीय बाल सुरक्षा कार्यक्रम, आशा प्लस आंगनवाड़ी वर्कर प्लस आयुष, both worked in this program. Till Asha take care till 6 months, Anganwadi take care 6 years of children, and Ayush take over of after that or in between in any severe conditions. Screening, here a screening done for 4D of these children. Any deficiency of any nutrition, defect since birth, developmental abnormality or disability which is acquired during the development, it is not present since birth, and disease of childhood like pneumonia, diarrhea, developmental abnormalities like anemia, like protein allergy, malnutrition, like food alterations, defects since birth like neural tube defect, anencephaly, gastroenteritis, gastrocele or anorectal malformation or benignness or congenital glaucoma. Deficiency is of macronutrients, vitamin A deficiency or protein energy malnutrition, it is also type. Now next program is Suman. Suman Surakshit Matritva Ashwasan, under which JSY, JSSY, Lakshya is an initiative to increase the quality of delivery rooms. Dakshita, highly skilled. Dakshita is a Hindi word which means highly skilled, and in which training to doctors and nurses are provided to decrease neonatal death and delivery complications. Now next is PMS Abhiyan, Pradhan Mantri Surakshit Matritva Abhiyan. First Abhiyan comes, then it is changes to Suman, Surakshit Matritva Ashwasan. You can say that Abhiyan is launched, and because of it's not so successful, so Ashwasan is given to the population so that something is happening. Red is PMSMA. Pregnancy divided into 3 categories: red, blue, yellow, green. Red, high risk pregnancies. Blue is for preeclampsia. High risk pregnancy is for any complications during or after or during or before pregnancy. Blue is especially for preeclampsia because it is of high mortality and high morbidity. Morbidity means long lasting effect on the woman's life. Yellow is for pregnancy with comorbidities. Comorbidities like obesity, hypertension. And green is normal pregnancies. Normal pregnancies without any complications. Shuman is for zero denial in government hospital for maternal health. Zero denial means any woman which is in need of any maternal service are not denied to any government hospital or private hospital. Next one is PMJ. PMJ comes Pradhan Mantri Jan Aushadhi Yojana, Jan Arogya Yojana. It comes under Ayushman Bharat. PMJ, there are two components: PMJ, Pradhan Mantri Jan Arogya Yojana, and Health and Wellness Center. PMJ will like 5 lakh health insurance, 5 lakh rupees health insurance for primary and government, private and government hospitals. Government include secondary, tertiary, because at the primary level all the facilities are almost free. For only for EWS, economically weaker sections, whose income is less than 10,000 per month, of 5 family members, in which all the present or past comorbidities are included in the insurance. Health and Wellness Center, 1.5 lakh sub centers are modified into health and wellness centers, non-communicable, in which facility of all the major communicable diseases, maternal and child health, and major non-communicable diseases like diabetes, hypertension, and three types of cancer: oral, lungs, cervix, oral, breast and cervix, psychiatric medicine, ENT facility, dental facility, and yoga and meditation. Now comes the Niti Aayog. Niti Aayog is a change, is the Department of Government, is the committee, national institution for transforming India, which provides all the plans to for planning commission. It is in replacement of National Planning Commission from 1950 to 2040. This is the logo of National Leprosy Eradication Program, in which hand is for government providing support to for flower of new cases, and ray of hope defined by the sun by the FTC, fixed drug combination, in which for elimination of leprosy less than 1 per lakh cases, filariasis and neonatal tetanus less than 1 per 1,000 cases. Drug of choice for lepra reaction is prednisolone, and we do not stop leprosy treatment or leprosy drugs only because of lepra reaction, because it is a hyperimmune hypersensitive reaction. International Mission Indradhanush include all vaccines of NIS. Mission Indradhanush 3.2 is the current version. All vaccines of NIS, which includes BCG, International Mission Indradhanush. Mission Indradhanush includes BCG, hepatitis B, OPV, all the birth dose vaccines, measles, and DPT. DPT includes 3 diseases. Indradhanush scheme is for 7 different colors bed sheets for 7 days a week. Different color bed sheets for different days, so as to increase the cleanliness. वो जावला योजना, जौ में food आता है. It's like we take food and inside our mouth and digest it. To just like that we prevent child from trafficking and take into their home rehabilitations. Ujawla is for free LPG cylinders with one-time gas for BPL category. Integrated Disease Surveillance Program to know steps approach. Integrated Disease Surveillance Program to know the high-risk population for NCD, non-communicable diseases. Steps approach is used, in which first is psychological or behavioral. Like smoking. We ask person, did he smoke or do alcohol, or what is his diet, or what is his exercise. Physical factors like BMI, Quetelet index. Hormonal or biological factors like RBS. Steps approval by WHO. Therapeutic factor not taken into account, in which in this second is biologic. Physical factors, we do examination, physical examination, anthropometry, BMI, and then last is hormonal or biological factors we do investigations for only diagnostic purpose, not for therapeutic purpose, because in this we do only always do RBS, random blood sugar. We never do a fasting because of the good compliance. Next comes now, in which T series vaccines plus PIO all follow open vial policy. T series are TPT, penta, hepatitis, TD, and PO, polio, PCV, IPV, and OPV. These all follow open vial policies. Which do not follow open vial policies are BCG, measles, Japanese encephalitis, yellow fever, rota not follow. रूबेला 24 आवर्स 2 आवर्स तक सर्वाइव कर सकते हैं. फ्रीज ड्राइड लायोफिलाइज रिकॉन्स्टिट्यूट वैक्सीन होते हैं. VMA 2, 4, 7, 14 and 30. In this numerical value indicates amount of days after which if vaccine is exposed to 37 degrees Celsius, I'm not sure. So after that, for continuous exposure for 37 degrees Celsius, this label turned useless. If till the inner circle color is less than the outer circle color, it is good for use. When the square is of same color or darker color than the circle, it is of to discard. Now this is the incentive for ASHA workers under GSSY, in which there are 10 low performing states, on which low performing states which we can remember by our Bihar, UP and MP, which are one of our largest states. Bihar and their subsequent parts which separated in 2020 2000 year 2000. Bihar part Jharkhand, UP part UK, Uttarakhand, और MP part Chhattisgarh. And 4 are Rajasthan, Odisha, Jammu and Kashmir and Assam. These are all low performing states, in which HPS is 700. High performing states, rural and urban, they are all divided into rural and urban. In rural, ASHA get 600, and urban USHA gets 400. Now if high performing states, rural state, mother gets 700, and in urban state mother gets 600. If low performing states, then the incentives have to be given higher, so double the incentive, 1400, and in urban 1000. Now next is Kaushal Bharat, in which low interest loan are also again given to the young entrepreneurs to start up their business. Atmanirbhar Bharat, in which decrease in input and decrease in interest load. SIDA, and we can all discuss this. And next is Poshan Abhiyan, also we can discuss. Active surveillance, we can RDT kit. Now RDT kit, here is active surveillance, which our male health worker goes door to door for finding the active cases, and prepare 2 slides. And the passive surveillance is all these cases come to the OPD or doctors for their clinic, once in 14 days. And this both are included in this combined sentinel surveillance. RDT kit for malaria, rapid diagnostic test kit for malaria. There are 2 types: histidine rich protein kit and lactose dehydrated enzyme kit, in which histidine rich protein kit are detected only Plasmodium falciparum. Lactose dehydrogenase kit and detect both Plasmodium falciparum and Plasmodium vivax. Anopheles. Now some discussion about Anopheles. It is a sophisticated mosquito, breeds only in clean water, live parallel to water. Its larva live parallel to water because of short or non-functional siphon tube. Spotted wings. It contains spotted wings or NSF while biting. Because of this, it's called Anopheles. It sits an angle by biting. Louse or lice, which we most commonly known as in our head. Like we crush them between our fingernails like this. It produces a sound of purr. This is a mnemonic. Pediculosis, epidemic typhus. Epidemic, it is shows any head relation. Epidemic above, relapsing fever, and trench fever. Trench fever is also called Quintana fever because it is caused by Bartonella quintana. Our next case is enzyme deficiencies. Enzyme deficiency, which we include Castle-Neck because of niacin deficiency, because of tryptophan deficiency. Tryptophan deficiency, maize diet, because of the maize diet eater. So, history of eating raw egg white. Raw egg white, history of eating. So, in this, X is evident in the raw egg causes excess evident in the raw egg causes for the decreased binding of biotin, binds with biotin, so biotin deficiency causes hair loss, bow leg, and because of vitamin D deficiency. Dental fluorosis, it is a water disease. More than 0.8 gram per liter causes dental fluorosis, and normal fluorine is 0.5 to 0.8. Chlorine, normal chlorine is 0.5 to 0.7. Residual chlorine decided by chloroscope. Residual chlorine, in which chloroscope there are two tests: orthotoluene test (OTT) and orthotoluene arsenide test. Orthotoluene both detect both free and combined, but orthotoluene test detected both for free and combined together, and OTA detects separately reagent not reacted to impurities. And its additional benefit is it does not react with impurities, nitrogen or iron present in the water. Now comes in this. If there is excess of chlorine and there is a complaint of dental fluorosis, we add if fluorine content goes higher than 1.5, this causes dental skeletal fluorosis, which causes pathological fracture. A patient complains, I go to toilet and sit for Indian type Latin, and I got fracture. When I get up, I got another fracture. So this is how the condition can go serious, and for which we prescribe him lime and alum bleaching powder (LAB) to his water, because to defluorination. For defluorination, this technique is called Nalagonda technique. And this comes now some about adulteration, food adulteration, in which there is khesri dal boa. Khesri dal contains boa, beta oxalyl amino acetyl, which is in causes neurolathyrism. If contaminated groundnut causes hepatocellular carcinoma of liver because of aflatoxin. Contaminated wheat and rye causes contaminated wheat and rye, which is contaminated by Claviceps purpura fungus, causes it contains ergotamine. Ergotamine, as we know, automatamine given in vasoconstrictions in migraine treatment. So this toxin also causes vasoconstriction in body extremities, finger extremities. So this causes necrosis of fingers and toes. Endemic ascites. Endemic ascites is caused by crotalaria seed, which is pyro pyrozolidine. Junjunia plant, because of making noise of junjunia. Epidemic dropsy is caused by mixing of mustard oil with argemone mexicana oil. Satyanashi, argemone mexicana, you can run by search Satyanashi, and sanguine toxin, bilateral pitting edema on leg. So you can say this, assume if you are sleeping sung of your dream life partner, and so you drop on the bed, and so like on pitting edema is also about dipping. So epidemic dropsy is caused by argemone mexicana sanguine. This way you can tell. Now come about Nalgonda technique. Nalgonda, sorry, my bad. This is about OCPs. OCPs, Mala and Mala D, both are of same composition, but Nala and Nishulk and D SSA. Mala N is come under free consumption for government supply without any cost, and Mala D comes with rupees. In this, ethinyl estradiol is for estrogen and levonorgestrel. Ethanol estradiol is of 30 microgram in mala and malady and 0.15 milligram in levonorgestrel. In low dose OCPs, it is of 20 microgram and levonorgestrel remains same 0.15. In IP, there is only levonorgestrel 10 times higher 1.5 milligram.